little known but dangerous vomiting disorder linked to long-term marijuana use is now officially recognized by global health authorities.
The World Health Organization has added cannabis hyperemesis syndrome, known as CHS, to its diagnostic manual for the first time. And NTD's Daniel Monahan spoke with Master's Certified Addiction Professional John Pulse about the ailment.
Cannabis hyperemesis syndrome, or CHS, can cause extreme nausea, repeated vomiting, abdominal pain, dehydration, and in rare instances, seizures, heart rhythm issues, kidney failure, and even death.
And the term scromiting has been kind of used pretty frequently, which essentially refers to when people are vomiting, they're simultaneously screaming because they're in so much pain.
The new code, adopted in the U.S. on October 1st, lets doctors identify and track cases instead of grouping them under general stomach illnesses. A recent JAMA Network open study shows CHS-related emergency visits surged roughly 650% from 2016 through the pandemic. Addiction specialist John Pulse says one reason is the significant increase in high-potency cannabis.
10, 20, 30 years ago, cannabis may have been 5, 10% THC. With the concentrates, dabs, and things like that, we're seeing over 90% THC now.
Pulse says taking long hot showers to relieve the symptoms is commonly reported, including from his own patients.
And that's really temporary, and I think it's important to understand that the main thing to do to relieve the symptoms is to no longer use cannabis. Once you've experienced cannabinoid hyperemesis syndrome, you're more likely to experience it again.
Adolescents and young adults are more at risk, and he says that's for a few reasons.
Adolescents and young adults use cannabis at significantly higher rates, and they're also more likely to use high-potency products as opposed to middle-aged and older adults who are perhaps used to some of the lower-strength products and prefer that.
Pulse says it's important not to downplay the seriousness of cannabis addiction.
One of the hallmarks of addiction is using despite negative consequences. So they'll make excuses as to why this is happening and justify it and want to continue using anyway because of the dependence on the substance.
The addiction specialist says more and more people are becoming aware of the dangers associated with cannabis.
It's often, for many years, been thought of as a benign, harmless substance and almost a rite of passage for many people. And it is true that you can find tons of examples of people that have not experienced significant negative consequences. What I see more of a call from the medical and clinical community is to have a balanced and honest discussion about cannabis, that there are people that do have these very severe and negative impacts.
Pulse says the WHO designation gives medical professionals and insurance companies guidance on how to treat it and diagnose it.
And it compels third-party payers, such as insurance companies, to pay for medical and psychiatric care related to this.
For anyone struggling with substance abuse, confidential help is available at the National Substance Abuse and Mental Health Hotline at 1-800-662-HELP. Daniel Monahan, NTD News.